It's 2 minutes. Namaskar, Dr. Rima, and good evening, everyone. So, let us start today's Yoga Pushpanjali 11 with 3 Omkar followed by prayer to take your shoulder back and make your spine straight. Your chin is parallel to the floor. Look straight. Now, slowly close your eyes. Your breathing is going normal and natural. For each Omkar, you have to inhale fully. For chanting Omkar, inhale fully and deeply. Om. Om Bhurabhuvasvaha Tassaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yo Naha Prachodaya Om Sahana Vavatu Sahanam Bhunaktu Sah Viryam Karavavahai Tejasvinavadhitamastu Ma Vidvishavahai Om Asato Ma Sadgamaya Tamaso Ma Jyotirgamaya Mrityormamrutangamaya Om Shanti Shanti Shanti. Keep your eyes closed for a while and enjoy the positive vibration of Omkar and prayer on your body and mind. Now slowly shift your mind from body to breath. Just observe your breathing. Now slowly come back from the breath to the body and enjoy the stillness, steadiness, and relaxation throughout your body. Now slowly open your eyes. Thank you, everyone. Over to Nitin, sir.
Thank you, Sonali. So, once again, welcome everybody. So, to this Pushpa 11 of Yoga Pushpanjali series. As all of you know, that Yoga Vidya Niketan is celebrating its 50 years. And as a part of this celebration, we are conducting this program of lecture series by eminent speakers. And so far, we have done 10 lectures in this series. Today is the 11th one, and we will follow the same protocol all the time. So at the end of the session, when doctor finishes her lecture, Then if time permits, then we can take question answers. And as usual, I once again request you to type your questions in the chat box, and we will take only the relevant questions if the time permits. So let us begin this program. Uh, I'll just brief you what it is all about today. So all of you know that there are two types of diseases, communicable and non-communicable. Communicable diseases are due to viruses, etc. for the external factors. And recently we have experienced coronavirus, which was among the communicable diseases. And non-communicable diseases are because of our own mistakes. They are therefore rightly called as lifestyle diseases. And in the last few decades, the number of lifestyle diseases have increased many folds. Okay. WHO says that nearly 74% of the deaths are happening because of these lifestyle diseases. Okay. All of you know these lifestyle diseases are nothing but cardiac diseases, hypertension, Alzheimer's, PCOS, a lot of accidents, and these diseases also means they need to be they are associated with comorbid depression and does need to be managed at with an integrated approach, and this integrated approach is of the yoga, which plays a major role and acts as the cellular and molecular levels. Okay, so today we have a genetist with us, and she will explain this subject very nicely. So for a brief introduction, I will ask Smita Madam to introduce today's speaker, Dr. Rima Dada from AIIMS, New Delhi. Over to Smita Madam, please.
नमस्कार सभी को. Namaskar to Rima ma'am and everybody in this session. Let us have a brief introduction of an eminent personality here with us today. Professor Rima Dada is on the is on the editorial board of several national and international journals and a member of various scientific bodies. She did her MBBS from Delhi University at Maulana Azad Medical College. Thereafter, she has completed her MD in anatomy at the University College of Medical Sciences, again under the Delhi University. She completed her senior residency and her PhD studies in genetics at AIIMS, New Delhi, and later she joined AIIMS as an assistant professor in the Department of Anatomy. She has the field of interest that she is into is genetics of reproductive disorders, ocular disorders, various childhood cancers, lifestyle interventions on markers of aging, doctor scientist, genetic diagnostic services, infertility, ART failure, endocrine disorders, etc. And she's also part of the task force under the Ayushman Bharat Wellness Initiative. And there are a lot of awards which I would like to specially mention about Dr. Rima. She has got the ICMR Shakuntala Amirchand Prize. She has got the GP Talwar Gold Medal. She has got Rashtriya Gaurav Award, Joseph Lister Researcher Award, ICMR National Award for Outstanding Contribution in the field of genetics of infertility, Young Scientist Award at the second European American course in clinical genetics in Croatia, the best oral paper awards, several international and national meetings, the American Society of Andrology, and the Award of Excellence and Innovation in Yoga Research, Kripalu Center, MA Boston, in Massachusetts, Boston, in the USA. Ocular research top 2% in the world. She has also she has more than 200 publications and 75 chapters to her credit. Once more, ma'am, I welcome you to this session of our 11th Pushpanjali of Yoga Vidya Niketan. Over to you, ma'am, for the lecture.
Thank you so much, Smitaji, and thank you, Dr. Nathan Tavle, for inviting me to deliver this talk. And I'll just share my slides and begin the talk. Can you see my slides?
Yes, ma'am.
Yes, ma'am.
Okay. So today I would be talking on yoga for health and wellness and role in lifestyle diseases. This is a topic So, firstly, I would emphasize why this topic is important, and I'll just give you a brief overview on the topics that on the subject that I would be talking to you today. Firstly, what are lifestyle diseases and how they have gained importance in the last few decades. And these diseases are also known as complex diseases because they occur due to an interaction between the genes and the environment. So there was a paradigm that we were brought up with that the genes determine our health and biology. But now the latest studies have shown that what actually determines our phenotype, our biology, is our environment. And that acts through the epigenome. And when I say the environment, it's our lifestyle, our habits, our thought, and diet. And it's been seen that this epidemic of lifestyle diseases occurs due to unhealthy lifestyle choices. For example, it's like excessive smoking, alcohol intake, a diet rich in trans fats, salt, sugars, a diet which is calorie dense but nutritionally depleted, which is known as the standard American diet, or also the deadly American diet, which more and more of amongst us are having. In addition to that, there is physical inactivity. Less than 5 to 6% of our population actually meets the criteria for the amount of physical activity which we need per day or per week. In addition to that, we are leading highly stressful lives. And this has actually led to this epidemic of complex lifestyle diseases. These are non-communicable diseases. And though we are living longer, yet our health span has not increased, but we are getting sicker in the sense that the diseases that we were experiencing at around 55, 65, 70 years are now occurring at 35, 40 years. It's been seen that 3 out of 10 children in school has hypertension. Large number of children are having high levels of stress, anxiety, and depression. Many young people are getting strokes and cardiovascular diseases. And our studies and many other studies have shown that majority of these diseases, it could be diabetes, it could be stroke, it could be depression, it could be primary open angle glaucoma, it could be polycystic ovarian syndrome, which is so common nowadays affecting girls. It could be autoimmune diseases or cancer. Majority of these diseases have some common underlying mechanisms. And, and through modern medicine, it's very difficult to target each of those underlying mechanisms. So modern medicine is very good when you're dealing with infectious disorders or you have surgical emergencies. But at the most, it provides symptomatic relief. But yoga actually can help to remove the cause of that disease and thus can actually not only cure the disease, but if practiced regularly, it can prevent the onset of diseases and actually promote health. And though we see that once a person does develop a disease, it not only acts as a powerful adjunct in the management, but also it is very useful because it has tremendous rehabilitative potential. And people who have practiced yoga who are unwell, they see faster recovery and longer periods of remission when they have some health issues. So what I want to focus on today is that lifestyle diseases are increasing because of our unhealthy lifestyle choices. Our lifestyle, our habits, our diets, and thoughts impact our gene output, the gene behavior, or the expression of genes through our epigenome. And epigenetics is actually the genetics of free will. Now, this knowledge is very empowering because it actually tells us that our choices determine our health and disease states. And the important thing is that the epigenome is highly dynamic. Though the genes don't change, the epigenome changes with our habits. And whatever we practice on a regular basis is going to impact our epigenome. For example, if you lead a very highly stressful life or you're having fast food every day you have samosas, every day you have chole bhature, every day you have a burger, every day you have sweetened drinks, every day you have processed food, over a period of time, this leads to chronic inflammation. Now, short periods of inflammation are good. They help increase our body's defense mechanism. But over a period of time, when you have chronic inflammation, this actually sets the stage for autoimmune diseases as well as cancer. So this is how our habits are determining our health and disease state. So it's been seen that when you lead a healthy lifestyle, you actually switch on gene programs which are beneficial for you. And when you practice unhealthy habits, you have fast food, you lead highly stressful lives, your sleep is disturbed, you have poor quality of sleep. These are actually impacting your epigenome and they switch on gene programs which are not beneficial for us. And I will talk to you today how yoga, which is a mind body energy medicine, which is India's greatest gift to the world, it's a profound science which has a tremendous impact on our health and our biology. And we've done studies and shown that how it positively impacts the output and the expression of our genes. And it acts like a polypill. It does not act on just one organ system, but it impacts both the mind and the body. And now we cannot treat the mind and body separately. For example, if you have depression, you may just think of giving them cognitive behavioral therapy, but it's been seen that when you have high levels of stress, anxiety, depression, they impact every cell and organ system of the body. And therefore, majority of these diseases, for example, if you have infertility, you have polycystic ovarian disease, you have autoimmune diseases, you have cancer, all these diseases have a strong psychosomatic component, and thus they need to be dealt with a mind body intervention by an integrated holistic approach, which is yoga. And yoga, you can see, not only is helping to promote health and prevent the onset of diseases, but it can act as a powerful adjunct in the management and also has tremendous rehabilitative potential. So it's been seen that in the recent years, there's been a huge increase in this epidemic of complex lifestyle diseases. And these diseases are not only occurring in the urban setup, but also in rural setup because our lifestyle has really changed dramatically over the years. We were a hunter-gatherer society, and over a period of time, we have become so sedentary, always sitting over, with our cell phones or with computers or with laptops. In addition to that, our diet has changed dramatically. We are now having diet which is highly processed, highly inflammatory. I told you it's a calorie dense diet which has led to this epidemic of obesity. And we can see that we are now being every day driven by advertisements to have food outside. The more we have food from outside, the more discounts we get. So we are becoming addicted to this lifestyle. In addition to that, more and number of people are now having non-veg food. And I'll just show you in the next slide how non-veg food is not only bad for our health, but also bad for the planet's health. And this unhealthy lifestyle has led to a huge increase in the incidence of diabetes, blood pressure, cancer, Alzheimer's disease. So there are several reports which have shown that it could be white meat or red meat. They are equally bad for us. And red meat kills and processed meats kill faster. And there was a report which has actually shown that the unhealthy, this is a Eat Lancet Commission report of 2019, which has shown that unhealthy diets pose a greater risk to morbidity and mortality than does unsafe sex and alcohol, drug and tobacco tobacco combined. So this is the impact of our diet on our health. And more we are seeing that how school children are affected by these disorders which used to affect older people. We are seeing younger diabetes is setting in at a younger age. We are seeing more and more students are victims of stress, anxiety, depression. So they are addicted to different substances of abuse. And we see more and more children are not playing outside, but they are just addicted to their computers and sitting all the time. And because we are not aware of these things, we are seeing that early in the morning we give our children breakfast, which is actually comprised of highly processed cereals, which are laden with salts and sugars. And it's been seen that such a highly processed diet actually disturbs the gut microbiome. And we need a plant-based diet, a whole plant-based diet, which actually nurtures the gut microbiome and ensures its diversity. And so it's very, very important to understand that junk food not only leads to an epidemic of obesity, but it is also impacting our mental health. And it's been seen that suboptimal nutrition is contributing to the epidemic of mental illnesses. And not only does it lead to obesity, inflammatory bowel disease, depression, but it is also responsible for a large number of these neuropsychiatric disorders which are plaguing our society today. For example, accelerated cognitive decline, attention deficit hyperactivity disorder, autism, multiple sclerosis are all linked to an unhealthy diet. Why is the slide not changing? Okay. So, and I also wanted to emphasize that not only is intake of non-veg food affecting our health, leading to a higher incidence of cancer, but it is also impacting the environment, our planet Earth, the health of our planet. Not only does it lead, this animal farming lead to a huge increase in the greenhouse emissions, it adds to the greenhouse emissions. It's been seen that animal farts are very high in methane. In addition to that, so much of our land is actually involved in raising for grass or preparing for animal feed. In addition to that, we are already facing a fresh water, drinking water crisis, and we see that for preparation, for keeping these animals, you need such a huge amount of water. So you can see this, they have shown what is the water per pound of meat that is required to raise these animals. So we have to be conscious that not only is it affecting our health, but also the health of our planet. In addition to that, we are also seeing that we are a number of people, and this is also the incidence of cancers are increasing, and it's also believed to be a complex lifestyle disease. Initially, we used to just blame cancers to be due to our genes, but now we know that only 2 to 3% mutations are highly penetrant, means that if you have a mutation, you will develop a particular disease. But it's been seen that majority of the changes that we see in our genes are only leading to an increase in the risk to develop the disease, but are not causal. And the major factors which are actually responsible for cancers are the environmental factors, and chief among them are our diet. So our diet is playing such a huge role. And in addition, there could be infections, but unhealthy diet, tobacco, alcohol consumption, a high intake of non-veg food have been directly linked to an increase in the incidence of cancers. So we see that because of this epidemic of non-communicable diseases or lifestyle complex diseases, we are spending so much to maintain our for our treatment that this is pushing a large number of people into poverty. And it's important to understand that the entire media and the industry is all driven towards managing disease, not promoting health, because that's where the benefit lies. And we need to understand, as I told you, that it could be any disease. For example, it could be diabetes, it could be stroke, it could be hypertension, it could be depression, it could be autoimmune disease, cancer, or Alzheimer's disease. All these diseases have some common underlying mechanisms. And what are they? They are stress, anxiety, depression, shorter telomeres because of inflammation, and there's chronic inflammation because of which we see an oxidative stress which targets the telomeres. So we are aging faster. There is enhanced apoptosis. There is a dysregulated immune system which affects our, also there is a dysregulated gene expression. There is disturbed sleep-wake cycle. There's persistent activation of the sympathetic nervous system because of which we are, again, high levels of inflammation. There is gut microbiome dysbiosis. There's angiogenesis is altered. And all these factors actually form the stage for majority of complex lifestyle diseases. And no modality in modern medicine can target all of them together. And I'll show you by giving few examples on our studies, which we've been doing since 2008, how that each of these factors is targeted by yoga. And therefore, if you practice yoga, you can actually, it acts on all these factors. So it can prevent the onset of disease. It can actually slow down the rate at which you're aging by helping to maintain the telomere length. It can decrease inflammation, oxidative stress. It can restore, prevent the immune aging and the dysregulated immune response. So there was this landmark paper which actually showed that healthy living is the best revenge. And in this, it's been seen that healthy lifestyle choices are therapeutic. For example, if you have a diet which is a whole plant-based diet, seasonal fruits, vegetables, grain, nuts, if you're physically active, if you lead mindfully, this I have added living mindfully, leading with having a sense of compassion, you minimize alcohol intake or stop alcohol intake, stop smoking, develop social connections, rich, healthy relationships, you can actually prevent the onset of these diseases. So now I'll tell you how yoga, as you all know, that yoga is a profound, this energy medicine, a mind-body energy medicine. And when we talk of yoga, we've seen that through our studies that when we say yoga, it's just not the asanas. Whenever I will say yoga, it will be asanas, pranayam, and dhyan, that is meditation. And you will see that yoga can not only promotes health, that is physical health, mental health, spiritual, helps to you to make spiritual progress. It can also prevent the onset of diseases. So yoga is a set of practices aimed at balancing physical, mental, and emotional well-being, employing postures, asanas, combined with breathing techniques, pranayam, and meditation. And meditation is nothing but the awareness. For our patients, we just tell them to be aware of their breath. And it is a state of being attentive to the present moment, a state of heightened awareness in a non-judgmental way. And there are different types of yoga. So as you know that yoga, there are 8 limbs of yoga, that is the Ashtanga yoga. And so yoga is actually not just what we practice on the mat, it is a way of life. It's an art of living. And so when we talk of yoga, it's not only what we tell the patient to do when they are practicing right in front of us, but also that they'll have to lead healthier lifestyles. They have to make informed choices about what is good for their health, have plant-based diet, avoid this processed food, packaged food. So now I'll just give you a few examples of the studies that we have done in various lifestyle diseases. Now there are several causes of infertility. I will talk of male factor infertility, and that too I will talk of unexplained male factor infertility. Now we always think that infertility, the inability to conceive after 1 year of regular unprotected intercourse is a problem of the females. And so infertility, recurrent spontaneous abortions, early pregnancy losses, we always blame the females. But our studies have shown that in approximately half the cases of male infertility or early pregnancy losses or recurrent spontaneous abortions, the male is equally to blame. And recent studies have shown clearly that the impact of our environment, the cell which bears the most damage is the sperm. And the reason for that is that it's believed that the sperm has minimal, because of its small size, it has minimal antioxidant defenses, and because it has a highly compact DNA, therefore majority of its repair mechanisms are also silent. They are largely silent, majority are silent. And therefore, the sperm is not able to protect itself from environmental factors, our unhealthy lifestyle, psychological stress. It all impacts the sperm. And therefore, the sperm DNA accumulates damage, and it is not able to repair its damage. It depends upon the oocyte to repair the damage. But when the damage is extensive, the oocyte is not able to clear it, can remove the entire damage. And it's important to understand that as we delay the age of marriage, the quality of the oocyte also declines. And even though we say that spermatogenesis occurs lifelong and a man can father a child till he dies, but the quality of the germ cell also declines in the males. So it's important to understand that in approximately half the cases, it's the male which is responsible for the infertility. And so there could be many causes. I am talking of unexplained male factor infertility. Now it's important that we understand that unexplained male factor infertility is important because these are cases where they have normal sperm count. All their hormonal parameters are normal. So one wonders, why are they infertile? Their sperm are normal, their morphology is normal, their motility is normal, and yet they are infertile. And these are sperm which have high levels of oxidative stress and DNA damage, because oxidative stress damages the DNA. And the sperm, as I told you, has very few antioxidants because majority have been shed during its development, and its DNA repair mechanisms are largely silent. And how does oxidative stress occur? It occurs because, again, because of unhealthy lifestyle, a sedentary lifestyle, a diet high in non-veg food, fast food, highly processed foods, smoking, alcohol consumption, and also exposure to endocrine disrupting chemicals which are found in our water, especially because of excessive use of insecticides, pesticides. And also these endocrine disrupting chemicals are found in our plastic water bottles and all these plastic packets which are used for packaging. So because more and more couples are now becoming infertile, it's been seen that more and more couples are going in for assisted conception, that is known as test tube babies. And male infertility could be one of the causes for which they opt for assisted conception. Now, these are men, as I told you, their sperm appears normal, but their DNA is damaged. So God made them infertile so that they could not transmit the damaged DNA to the next generation. But through these test tube babies, they're transmitting the DNA damage to the next generation. So it's important to understand that if you transmit the DNA damage, not only will your offspring be infertile if it's a male, but in addition to that, they could be having a higher incidence of genetic and epigenetic diseases. And it's been seen that when you use these techniques in one generation, the more you will need it in the next generation. And therefore, it's been seen that in Netherlands and in Denmark, it's been seen that 3 children in a class of 30 are conceived through these techniques. So our studies, I'm just going to summarize what I talked till now. So there are a huge number of lifestyle factors: smoking, alcohol consumption, advanced paternal age at the time of conception, psychological stress, excessive use of cell phone, exposure to endocrine disrupting chemicals, air pollutants. They result in oxidative stress. The oxidative stress damages both your nuclear DNA and your mitochondrial DNA. Mitochondrial DNA is a source of energy, and when it produces energy, it also produces free radicals. And when there is oxidative stress, it damages the mitochondrial and the nuclear DNA. And because the sperm cannot repair its DNA, therefore it results in accelerated aging of the sperm because of shorter telomeres, because oxidative stress targets your telomeres. It results in the accumulation of various adducts which induce mutations and epimutations, and it also results in fragmentation of both the mitochondrial and the nuclear DNA. So what is this going to result in? If this sperm then fertilizes an oocyte, it results in congenital. First of all, the couple could be infertile, but it also results in recurrent spontaneous abortions. If a child is born, it could have higher number of congenital malformations. It could have childhood cancers, complex neuropsychiatric disorders like childhood depression, schizophrenia, autism, attention deficit hyperactivity disorders, dominant genetic diseases. So all these are due to the father. So the male is having such an important role. And since men are not aware of it, the women are blamed, and then men do not take any measures to prevent this. The important thing is that these men are having this exposure over a period of time. And so this is also not only impacting your DNA, but it is also impacting the expression of the genes, the epigenome. And we have to remember that anything that we have been doing on a regular basis, if it could be unhealthy lifestyle, psychological stress, it is impacting the germ cells, both in the male and the female. And the most important thing that we should remember is it not only impacts you, but it impacts the future generations, because the epigenome is metastable, and these are transmitted to the other generations. So we have a huge responsibility, because through our lifestyle choices, we are not only impacting our health, but the health of our children and also those of our grandchildren. So we assess the level of DNA damage. These are just 2 techniques. One is COMET, one is sperm chromatin structure assay, by which we quantify the level of DNA damage. And you can see here, these are just fluorescently labeled sperm. And you can see that here the majority of the fluorescence is in the region of the head. But here you see that these sperms are having long tail. That means there is higher level of fragmented DNA. In addition to that, if you look at these graphs, you can see here that if you look at towards the x-axis, these are the number of sperm with damaged DNA. Each dot represents the sperm. And the number of sperm towards the x-axis are the ones with a good quality DNA. And you can see at once that the number of sperm in the infertile men are more towards the x-axis. So we also quantified, as I told you. So when you have DNA damage, we want to understand what is the cause of the DNA damage. So we assess the level of this base, which is 8-hydroxy-2-deoxyguanosine, which is the base which induces mutations and epimutations. And we find that in these people who have unhealthy lifestyle, they are having tobacco, excessive alcohol consumption, increased exposure to insecticides and pesticides. These men have high levels of DNA damage, and this is transmitted to the children. And these are children who have high levels of this base in their blood. And as compared to the children who are healthy, these children who have cancer have higher levels of this base, which results in post-zygotic mutations in these children. So what does the doctor do? he prescribes that we have antioxidants. So this is a study this is a double-blind placebo-controlled trial, and we see that when you take antioxidants, they do improve the sperm motility, it improves the sperm morphology, but there is very little impact on the DNA damage. This is the DNA fragmentation index, and you can see that after 3 months also, the DNA damage does not show any change. Because the DNA is so compact, there are very, very few antioxidants at therapeutic doses which are able to enter the DNA and minimize the oxidative DNA damage. So you can see that that with antioxidant supplementation, the impact on the sperm motility morphology will improve. So the sperm's fertilizing capacity will improve. However, there will be minimal improvement in the DNA quality, except a few antioxidants, very few in therapeutic doses, is able to impact the sperm DNA. So not only is there DNA damage, we also see that there is an altered expression levels of various genes. Now it's been seen that at the time of fertilization, the sperm is not only transmitting DNA, but a large number of RNA and microRNA which are required for early embryonic development. And why I'm showing you this is because I'll show you now what is the impact of yoga on the DNA damage, on the oxidative stress, as well as on these dysregulated transcripts. So I just wanted to show you that when there are men with poor quality DNA damage, they have children with these cancers. This is retinoblastoma, which is cancer of the retina, which is one of the commonest childhood cancers. So now I'll talk of the impact of yoga on the sperm genome and epigenome. So I just wanted to show you that so when these groups were made to practice yoga, so there were two groups. There was a group practicing yoga and there was a group not practicing yoga. And we can see that the total antioxidant capacity in the group that practices yoga increases versus the group that did not do yoga. So what is happening is that the antioxidant levels are increasing just by practice of yoga because the expression of those genes which are coding for antioxidants is increasing. In addition to that, when you see that the telomerase activity, this is the enzyme which helps to maintain the telomere length, its expression increases and its activity increases. So this helps to maintain the telomere length versus the group in which they did not practice yoga, and we find that there was no change in the telomere length. Now, we also see that post-practice of yoga, we see a significant decline. As I told you, this is the base that actually results in mutations and epimutations. And you can see that post-practice of yoga, there's a significant decline in the level of this oxidative DNA adduct, which induces both mutations and epimutations. Now, this is important. These are the first studies to show how yoga can impact your DNA, how it can reduce the oxidative DNA damage. In addition to that, again, this is the first study to show that how yoga can also change your methylation levels. Now, it's been seen that when there is oxidative stress and DNA damage, the oxidative stress causes global hypomethylation and the genome becomes unstable. But when the oxidative stress declines, because you see that when the oxidative stress levels are declining because there's an increase in the total antioxidant capacity, the methylation marks are re-established. And we can see that in the yoga group, there is an increase in the levels of 5-methylcytosine versus the group that did not practice yoga. And we see that the oxidative product of this methylcytosine is 5-hydroxymethylcytosine. Its level goes down post-practice of yoga. In addition to that, again, this is the first study where we have studied the sperm methylome after practice of yoga of the sperm methylome. And we see that there were a large number of epigenetic marks, large number of differentiated methylated regions, and a number of genes which are helping in spermatogenesis, embryo implantation, formation of the cytoskeleton. Their expression increases post-practice of yoga. And we can see that with practice of yoga over a period of time, though oxidative stress decreases within 10 days of practice, for significant decline in the DNA damage and for improvement in the DNA quality, it takes about 180 days, 6 months. So the main thing I would like to emphasize here is we must practice yoga on a daily basis. For example, just like we have food, we should make it at least for 30 minutes in a day. practice yoga because it can actually improve your DNA quality. And you can see that the number of sperm towards the x-axis have decreased post-practice of yoga, and showing that there is a significant improvement in the DNA quality. Not only that, we also did this study where we assessed the quality, how the parents who had these children with cancers, eye cancer, how they responded, and we see that it reduced the caregiver burden and also the psychological stress and improved the quality of life of parents of children with retinoblastoma. So now I'll talk of polycystic ovarian syndrome. Now, polycystic ovarian syndrome is it's a complex endocrinopathy which is affecting girls both in the urban and the rural setup. And it's been seen that it affects actually about 26% women in the reproductive age group. And it is characterized by some common problems. For example, there is not only is there clinical or biochemical hyperandrogenism, because of which there is hair fall, there is excessive hair in unwanted places, and like this, or there could be hair fall, or you find there is the cystic acne. We find that there is ovulatory dysfunction, because of which there is oligoovulation or anovulation. There are menstrual irregularities. There is polycystic ovarian morphology. In addition to that, it's not just a reproductive disorder. It's been seen that these women have a higher incidence. The majority of these women are obese. They have insulin resistance. And it's been seen that not only this, but if left undetected and untreated, it's been seen that majority of these women develop other problems like type 2 diabetes, coronary artery disease, cardiovascular disease, hypertension, non-alcoholic fatty liver disease, Alzheimer's disease, ovarian and endometrial cancers. And it's so important to understand that these are actually increasing now because of our unhealthy lifestyle, because of sedentary lifestyle, and again, a diet which is highly processed diet and an inflammatory diet. So these are the features. But the most important thing to understand is that not only is there hyperandrogenism, hyperinsulinemia, but it's been seen that there are other factors which are also involved in the disease causation, and these are: there's a dysregulated immune response, there is mitochondrial dysfunction, there is oxidative stress in these cases, and insulin resistance. And I'll just show you the results of our studies. This study is still ongoing, and you can see these are our patients practicing yoga. So we find that with practice of yoga, there is a significant decline in the free radical level. So the oxidative stress goes down. So you can see what happens normally when people are not aware. So we are just treating, aiming at, for example, if the couple is infertile, if the woman is infertile, we'll give them treatment for their infertility. If they have menstrual irregularities, we'll give them something. For example, if they develop diabetes, we'll give them insulin sensitizing drugs. If they have hyperandrogenism because of hirsutism and hair fall and cystic acne, we'll give them anti-androgenic drugs. But what is important to understand is there are so many other factors which are involved. For example, oxidative stress, a dysregulated immune response, mitochondrial dysfunction. So you can see here what is happening. We've studied. So the oxidative stress is coming down in these women. The factors which are inducing inflammation, like interleukin-6, its level goes down. The tumor necrosis factor alpha, again, which causes inflammation, is going down. The telomere length is also showing a significant improvement. And you can see that the mitochondrial copy number this is in healthy women. You can see that the mitochondrial copy number is also showing a significant increase post-practice of yoga. In addition to that, not only have we studied these parameters, but also a large number of genes, their expression. For example, the gene which is actually regulating mitochondrial transcription, its level increases. The levels of these genes which are causing inflammation decreases. The level of insulin receptor expression goes up. So in this disorder, we find there is hyperinsulinemia because of insulin receptor. There is resistance. But we find that because the expression of this receptor goes up, therefore the insulin levels come down. We also see that a large number of microRNA, which are regulating the expression of various genes which are involved in carbohydrate and lipid metabolism, their expression is changed, and they regulate the expression of various other genes. And we see and it's also been seen that women who have PCOS and higher levels of testosterone, they also have high levels of stress, anxiety, and depression. And we can see that the levels, the severity of depression goes down post practice of yoga, and there's an overall improvement in the quality of life. So our studies findings showed that yoga actually helped in the normalization of various hormones which are dysregulated. The AMH level came down, the testosterone levels came down, the SHBG levels increased, and there was reduced stress, both psychological and oxidative stress. There was reduced inflammation. There was a normalization of the menstrual cycle, reduced severity of hirsutism, and 9 of the 30 women have conceived within 2 years of the start of the study, and the study is still ongoing. And you can see that the severity of hirsutism in these cases see, this is the same woman. You can see the level of hirsutism has gone down post practice of yoga. See this woman, the hirsutism severity has significantly gone down. And these women are still not on any treatment. So now I'll talk of an autoimmune disease, which is rheumatoid arthritis. Now this is one of the most severe autoimmune diseases in which there is chronic, progressive, severe inflammatory arthritis, which affects the joints. And not only does it affect the joints, so not only it affects it's affecting the joints, it's an inflammatory arthritis, but it also affects other organ systems like our brain, the heart, the lung, the skin. And again, in this, there is an exaggerated immune response which targets the self-antigens. So we did this randomized control study, and you can see that post-practice of yoga, there was a decline in the disease. So there were 2 groups, one which did yoga and the one which did not do yoga. And in the group that practiced yoga, we find there's a significant decline in the severity of depression. And in the group that was just on disease-modifying anti-rheumatic drugs, there was not a significant change post-practice, post the drugs they are taking for their treatment. We also find there's again a significant decline in the severity of depression. In addition to that, we find that various inflammatory cytokines, for example, interleukin-6, which causes extra-articular symptoms, its level goes down. And you can see here that post-practice of post-practice, we find there's a decline in the levels. In addition to that, we can also see that when the people who practice yoga, the levels of interleukin-17. Now, interleukin-17 is the one, this inflammatory cytokine actually targets the joints. Its level goes down. The level of tumor necrosis factor, which is actually causing synovial hyperplasia, it causes osteoclast proliferation, which erodes the bones. Its level also goes down. And in addition to that, the level of anti-inflammatory cytokines goes up. So the inflammatory cytokines are coming down and the anti-inflammatory cytokines are going up. The other important thing, we also found that in those families where there was a genetic basis of developing that autoimmune disease because of some insertion, deletion, polymorphisms in the genes, we find in those cases the HLA-G levels are low. And so they develop these autoimmune diseases. But you can see that post-practice of yoga, the levels actually go up post-practice of yoga. And we also see that there is a decline in the oxidative stress and increase in the total antioxidant capacity. Why I put this slide was to show that it could be any of these lifestyle diseases. All of them are having oxidative stress, inflammation, shorter telomeres. And these are some common underlying mechanisms. We also find that yoga or these autoimmune diseases, because there is a dysregulated immune response, these cells, which are the T helper 17 cells, which are the ones which are secreting the inflammatory cytokines, their level goes down. Whereas the regulatory cells, which help to maintain the immune homeostasis, their levels go up. In addition to that, immune aging slows down. So we see that the number of aged cells go down after practice of yoga. And in addition to that, yoga not only is improving your nuclear DNA damage, but it is also improving your it's improving the mitochondrial DNA quality. And again, this is the first study to show that yoga improves also the mitochondrial DNA quality. And it also is helping improving your all 4 domains of quality of life. And we can see that the mitochondrial health is improving post practice of yoga. And the level of this nicotinamide adenine dinucleotide also increases post practice of yoga. And this is a very important molecule because this is helping in DNA repair. It is helping in maintaining the mitochondrial and nuclear DNA crosstalk. Its level increases post practice of yoga. And so this is important because uh, also this is a very important finding because it's been seen that with aging there is functional decline because the mitochondria get damaged, and so they produce fewer amount of ATP and more amount of fewer ATP and more amount of free radicals. So if we can improve the mitochondrial integrity, we can actually slow down the rate of aging. So we are spending millions and millions of dollars in buying products to reduce the rate at which we are aging or put on various creams and all so that so that we do not look so aged, but we can actually reduce our biological age just by practicing yoga. So now I'll just talk of glaucoma, which is also known as Kala Motia. And it's important to understand that, again, if not detected and treated on time, it results in irreversible blindness. And though it was believed that the only thing that could actually be targeted would be the increased intraocular pressure, which is found in glaucoma. But it's been seen that there are other factors also which are responsible for damaging the retinal ganglion cells. These are not only the increased intraocular pressure, but reduced blood flow, glutamatic cytotoxicity, oxidative stress, decrease in the level of various factors with the neurotrophins, inflammation again, and nitric oxide reduced levels. And our studies have shown that yoga again causes a decrease in the expression of these genes which are causing inflammation. They increase the level of factors which are protecting the neurons. They help to maintain the trabecular meshwork so that the aqueous humor can flow out, and reduces the expression of the inflammatory genes and the genes which were causing enhanced apoptosis and neurodegeneration. And our studies have also shown that meditation actually enhances brain oxygenation and promotes neuroplasticity and improves the quality of life of patients who practice of primary open angle glaucoma. So I'll just now talk of depression, which and India is believed to be one of not only the diabetic capital, but also one of the countries with a large number of people suffering from depression. And very few of them have access to health care. And again, this was a randomized control study. And so we had people who were doing, the ones in gray are the ones who were doing yoga, and the ones in black are the ones who were on medications. And you can see the ones that practice yoga showed a significant decline in the severity of depression. Now, why did this occur? This occurs, it's been seen that in depression, there's a reduction in the levels of serotonin. And the most commonly sold drugs in the market are serotonin analogs. And when taken for long periods, they have numerous side effects. And it's been seen that after some time, the people again develop depression. But we see that when you practice yoga, you increase the level of various factors which promote neuroplasticity. So not only are there changes in the levels of the neurotransmitters and certain chemicals, but you're actually bringing about anatomical changes in the brain. For example, the size of the amygdala, which is a center for fear, anger, stress, it actually goes down. And the parts of the brain involved in memory, in executive functioning, reward and processing centers, their size goes up, the gray matter increases. And this occurs because of increase in the levels of brain-derived neurotrophic factors, various cytoprotective factors, and increase in melatonin. Now, not only that, it's been seen that people who are depressed, they have a disturbed sleep-wake cycle, and melatonin is the key molecule which helps to maintain the sleep-wake cycle or the circadian rhythm. And therefore, when the melatonin levels increase, it helps to regulate their sleep. And this also helps to regulate their hormonal cycles because hormones are secreted with their sleep-wake cycle. They coordinate. In addition to that, melatonin is one of the most potent antioxidants. And its highest concentration is found within the mitochondria. And it's been seen that so it helps to improve the mitochondrial integrity, and melatonin crosses the blood-brain barrier and is also neuroprotective. So this is a very important message that people, if they practice yoga, you can prevent the having stress, anxiety, depression, because your coping mechanisms, your emotional resilience will increase. And it's also important that if we bring these studies and children start practicing yoga, they can enhance their concentration, attention, learning, memory, the cognitive abilities. More and more people are suffering from cognitive decline as they age. There is Alzheimer's because there is, accumulation of certain proteins and inflammation in the brain tissue. But if you regularly practice yoga, you can actually enhance your concentration, reduce the rate of cognitive decline, improve your attention, agility, coping mechanisms, emotional resilience, and you can and because there is an increase in the level of these factors which are promoting neuroplasticity. And again, depression is associated with oxidative stress, so people who are have depression, they age faster. So we find that their telomere length is also maintained. So it's been seen that people with depression, they have higher number of other lifestyle disorders, and they age faster. And we've seen that irrespective of their genotype, the number of people who had remission in the yoga group was much higher than in the group that was just on drugs. So it's very important that we integrate yoga into our lifestyle. And not only that, we also studied the expression of various genes, and we find that the people who practice yoga, we find that there is an increase in expression of tumor suppressor genes. So this is protecting your DNA, and also cell cycle clock genes, they show an increase. Helping to maintain the circadian rhythm. And all 4 domains of our quality of life show an improvement post practice of yoga. So I would just like to sum up by telling you that yoga is an art of living, and it modulates the internal pharmacy by switching on gene programs which are beneficial for us. So yoga has tremendous transformative power, and it causes dynamic changes in gene expression. It not only improves your mitochondrial it not only regulates your gene expression, but it also improves your mitochondrial and nuclear DNA quality, and all the factors which were responsible for these lifestyle diseases like shorter telomeres, stress, anxiety, depression, inflammation, oxidative stress, enhanced apoptosis, dysregulated blood flow, or there was a high hyperactivity of the hypothalamo-pituitary adrenal axis. All these factors are targeted by yoga. And so yoga is actually a poly pill which is switching on and which is enhancing expression of genes which are beneficial for us. So it's very important that we integrate yoga in our daily life so that we not only improve our physical, mental health, and it will prevent the onset of these diseases. It will help to promote our health. And if you already have a disease, it will help as an adjunct in the management of these diseases. Thank you. So any questions?
Yeah, thank you, doctor. You have actually ahead of time. It is only 5:30.
Okay.
But it was very wonderful lecture. You did justice to what you were talking to it, and it was very certain facts which came up were really alarming. That that gene expressions can be changed with you. That's a very good. We had heard about it, but you being a hardcore scientist and a researcher, you presented the papers. That was really wonderful for all our listeners. It was, and certain facts also were eye openers that regarding the sperm motility of the means how male are responsible for it and all. So I would request our listeners, if there are any questions, if you want to ask something to doctor, you can come forward and we will ask some questions if you have some doubts.
Before that, ma'am, can you stop the sharing, please?
Yeah.
Just 1 minute, 1 minute.
Yeah, sure.
Yeah, no problem.
Stop sharing.
Please
Yeah.
type the questions.
Yeah, I will take the questions. I'll take the 1 second. 1 second. I'll just go through this. There are thanks for the excellent lecture. 1 second. One question is there. what are the conditions in which yoga should not be performed? Health conditions, physical conditions, etc. That is one question is there. What are the conditions in which yoga should not be performed? That is what this person is asking. It's from Dr. Raja Singh, Delhi.
Okay, so the first thing that I would like to emphasize is that when you start doing yoga, it should always be learned from a trained yoga therapist. The reason is that they take a detailed history and only then the yoga program is tailor made for you. For example, if you have hypertension, just giving an example, if you have hypertension and you don't tell the yoga instructor, or the yoga instructor is not well trained, in those cases, they may tell you to do Kapalbhati, that is forceful expiration. That will increase your blood pressure, or make you do Brahmari very forcefully. That will increase your blood pressure. That will increase the severity. It will also increase your intraocular pressure. Suppose you had some surgery, you have hernia, or you have cervical spondylosis, then certain asanas should be avoided, or certain pranayams should be done very, very gently. So these are important. So I think it's not that I will not make a blanket statement that it should be avoided, but it's important that it should first be done after discussion with a yoga therapist, so that if you have some pre-existing conditions, they are kept in mind before, giving you. For example, when you are having depression, then we tell them to do more active asanas and less of meditation, because if you make them meditate, they will go into a ruminating state and start getting more negative thoughts. So we just have to see the patient's pre-existing condition and then guide them accordingly.
Nice. And there is one very basic question, and it's a very interesting question. We all believe, as a yoga lovers and yoga practitioners, we believe that it is helping in lot of things. But one question is there, how yoga is helping to modify the genetic disorders? Means how exactly, what is the mechanism? I think he wants to know. That is from Krishna Pitla. That is how exactly it is means modifying the genetic disorders. Yes.
Now, I would just like to first of all bring to your this notice that what I'm talking today are of complex lifestyle diseases. These are diseases in which there is an environmental factors and there are large number of genes. So these are polygenic, number of genes and each having a small additive effect. Okay. Then you have monogenic disorders, and in those there would be certain mutations, and those, as I told you, there are certain mutations which are highly penetrant. If you have the mutation, you will develop the disease. But majority of the other disorders, the mutation will just increase your risk or susceptibility to develop the disease. They are not causal, they increase your risk. Now, when you practice yoga, you can actually change the expression of the genes without changing the nucleotide sequence. Till now, we believed that the only way we could change the expression of genes was by causing some changes in the DNA sequence. But now it's known that when we practice yoga, we are causing hypomethylation of good genes, the ones which are genes for DNA repair, genes which are coding for the anti-inflammatory genes. Their expression level is going up. The genes which are actually inducing certain in the inflammation, or the oncogenes, which are when they are mutated, there is a gain of function. Yoga causes their hypermethylation. So the chances of cancer decreases. So by acting on the epigenome, so there were 2-3 questions I saw. What is epigenome? Epigenetics. It is the studying the expression or the change in the expression of DNA without any change in the nucleotide sequence. And this occurs by certain biochemical changes or covalent modifications of the DNA base without any change in the base, or some post-translational modifications of the proteins associated with the DNA. So this is how yoga is acting.
Yeah. And then adjacent to this, immediately Utkarsha has a question. In all the studies mentioned, result is based on the pre-yoga and post-yoga. Obviously, it is there. The difference between that is shown. But how that means, was there any program duration specified, or somebody was practicing it for 10 minutes, somebody practicing for longer durations, etc.? So was there a specific program you wanted to know?
Oh, yes, yes. We have different programs for different groups. For example, it is 1 hour per day, 5 days a week, and the people used to come. after for 1 month, and then we try to make them do online, and we are watching them when they're doing online with a group that is practicing offline in our presence.
Yeah.
In our presence.
Yeah, and ultimately it has to be a lifestyle, not only that particular period or anything. It is to be continued for the entire lifespan. That is
Yes.
the one thing everybody has to understand. So you mentioned about the glaucoma. So Shama has a question that glaucoma, what is the specific practices, asanas or anything, whatever yogic practices you have suggested for the glaucoma, maybe for intraocular pressure reduction, etc.
Okay, we did it in cases with primary open angle glaucoma, and the main emphasis here was on meditation and anulom vilom, doing anulom vilom, and just the awareness of breath. We though they did a little bit of asanas, few asanas, but now we are trying to get a protocol which is minimal time. For even for 15 minutes of anulom vilom, you do it 2 to 3 times in a day. That is good enough for decreasing the intraocular pressure.
Yeah,
I'm not telling you to do any asanas right now because, if you're not doing it unsupervised, it can lead to increase in intraocular pressure. So I'm saying the best thing would be meditation, that is dhyan, and or you just awareness of breath, and best is anulom vilom.
Anulom Vilom means for this is Nadi Shodhan Pranayam. What is that?
So actually,
I learned it
before
training.
anulom vilom, you can do this Kapal Bharti, but it should be done very, very gently, because when you do it vigorously, it will increase your intraocular pressure. So I'm not saying that at all right now. Yeah, supervised, we would tell them, but
Yeah.
otherwise, just anulom vilom, that would be good.
Means instead you should not do any harm. Yeah.
Yes,
That is-
yes.
Then one more question is there. Can it help the mentally disabled?
Oh, definitely, definitely it can help. And it's been seen that it definitely, because it is helping to increase various factors which are promoting neuroplasticity, building coping mechanisms, emotional resilience. And we were actually working with some disabled groups, and it's been seen that especially for example, in autism, we were just planning to start a study, and we were seeing that just few families, that when the parents learn and they do it with the child, the results are so much important because they develop more social connectedness, more eye contact with the child. So it's very, very important. Yes, it is very, very useful in these disorders. And there have been studies in the institute where they've shown even for epilepsy, the yoga has really benefited them.
Yeah, especially since you mentioned autism, can you throw some light on this, particularly autism, how it occurs, means through the genetic changes the autism takes place. I have read some papers saying that autism means this lifestyle. Obviously, it is a lifestyle disease because of the fast foods and all this is leading to this autism. So, can you just briefly tell our listeners regarding autism and how it can be, how yoga can be helpful in the autism? That is my question.
Yeah, so I'll just tell you, we have not done much work on autism, and I would be the wrong person to talk on this. Though we've seen that fathers who had poor quality DNA, their children had higher incidence of autism. And we found that the expression of various genes which are promoting synaptogenesis was lower, and we found that. And we also, once I was just, we were talking to many various groups which are working with disabled children, and with the ones who have these specially able children with autism, and we were discussing that when they were actually doing it, so we were thinking of starting it in a big way, that that for these children it should be parents and children doing together, because that will help to build the connections with the parents, more eye contact, children start interacting better. But I'm really not the right person right now to talk on this. Maybe after 1 year, when we have a full-blown program, I could give you more details.
Yeah, because this number of autistic children are increasing. This number is alarming.
Absolutely.
That is what I wanted to raise this question. Anyway,
Right.
one more question is there regarding the autoimmune disease. How yoga can help in autoimmune disease means.
Yeah, so like in autoimmune diseases, the there is a dysregulated and an exaggerated immune response where your body's immune response targets your self antigens.
Yeah.
And
Yeah.
yoga helps to regulate your immune response. Like we showed that there is an imbalance. The ones which are producing the inflammatory cytokines, their expression, those cells, their expression goes down. And the ones which are helping to maintain the immune homeostasis, the regulatory cells, their expression goes up. Therefore, yoga can help to reduce the severity and re-establish immunological tolerance in these cases, and therefore bring about a molecular remission in autoimmune diseases. So yoga is beneficial.
Again, there is one interesting question. It's asking that are there some different sets of practices for correcting genetic disorders, or in general you have to carry on all, means there are different sets of practices, different yoga practices, meditative practices, pranayam, etc. Are there certain regulatory practices? That may be the question.
No, I would just like to emphasize, like in certain genetic disorders, I told you, like which are monogenic, it will be very difficult to bring about changes. But when, as I told you, in complex lifestyle diseases, because these diseases are only increasing, for example, I'll just give you an example. Like we say, diabetes is running in that family, but not all members of that family will develop the diabetes. The reason is one is actually leading a healthy lifestyle. They are aware it's running in the family. They are physically active. They are having plant-based whole foods. So, all these things matter. So those sort of disorders which are polygenic, each gene having some additional increasing your risk, those can be regulated. But those gene disorders which are monogenic, it will be very difficult. At most, you'll just be able to improve their quality of life by building their other factors, resilience, but not that disease per se.
Yeah, and there is question from Dr. Amrita Shena. Do you also recommend dietary modifications along with yoga practices? That is one thing she has asked.
So that's a very good question. The thing is that yoga is a way of life. So when we talk about them, we tell them about the importance of having a plant-based diet, to avoid fast foods, to avoid non-veg food, because the yum niyam, all those rules, and so you cannot harm others for our taste. So yoga, as I told you, is a way of life. So we definitely tell them about the importance of a healthy plant-based diet, non-packaged, non-processed food, fewer preservatives, avoid non-veg food. Definitely, we do counsel them regarding diet.
Yeah, very good. And then you have created such an enthusiasm. I can see one question coming up. How can one participate in such research sessions which you are conducted? If somebody wants to get participated into this, can somebody be a part of such a study? Want to get? So that is the one question that has come.
Actually, we get patients from doctors who are, we have projects, and the clinical counterparts, they will send us cases. For example, the ophthalmologist is my brother, Dr. Dada. Then we have other doctors in urology. We have doctors in gynae. Only those patients which are referred to us, they can participate in these studies as of now. We've started studies in Alzheimer's now and aged people. For that, we are going to old people's homes where we can find a large number of patients with cognitive disabilities and difficulties, memory loss. So there we are doing, in large number of patients who are involved in these studies. But otherwise, randomly, we cannot take from outside.
As you are answering to my question on the autism, there somebody is asking, I mean Kashmira, she is asking, is only the father's gene is responsible for autism? That is the question.
No. Again, it's a disorder where multiple genes, so both maternal, paternal factors are responsible. Both. I think they should know. Since my work is on male factors, so I target that. But the important thing is that since men are not aware, that leads to so many problems, because when we get couples with infertility, they are not ready to accept it that it's the male which is responsible for the problems. So at least the awareness, and because they are aware, they can lead healthier lifestyle to improve the quality.
Yeah.
So they should be at least aware that they are equally responsible. That can, improve things.
There is one question from Dr. Mansi also. How does yoga alter the length of telomeres? Can you please elaborate?
Yeah, that's a very important question. See what happens. Telomeres are capping the ends of chromosomes, and they are hexameric repeats which are guanine rich. And guanine is the one having lowest oxidation potential. So what happens when there is oxidative stress? It targets this telomeric DNA and it becomes shorter and shorter. And once the telomeres short, they become shorter and they reach a certain length, these cells stop dividing. And that's when we say that we have aged. And so with a particular, so we when the telomeres shorten faster, we are aging faster. Now, what yoga is doing, it is targeting three things. It is decreasing your oxidative stress because telomeres are attacked by free radicals, that is oxidative stress. So oxidative stress decreases because the free radical production by mitochondria decreases because the mitochondrial integrity improves. The total antioxidant capacity improves, so again regulating the free radical levels. And then the telomerase activity improves. So when the telomerase activity increases, so what we find that the telomeric repeats are added to the ends of the chromosome, so it helps to maintain the telomere length. So this is very, very important because so many, you take such high levels of antioxidants and all, but too much antioxidants can disturb the balance. You need certain amount of free radicals, optimal levels to maintain the telomere length, not too low, not too high. And yoga helps to maintain the optimal length. And because it also increases the telomerase activity, it is helping to add on those repeats. So it is delaying accelerated aging.
Yeah, one more question I would like to know, madam. Since we say that your thoughts decide your gene patterns also, so means that your thinking pattern, how you are thinking, what are your thoughts coming. So can you throw a little bit light regarding our thought patterns and gene expressions? Just.
Yes, that's a very good question. And, like they say, the power of positive thinking. Now, it's been seen that we have about 80 to 90,000 thoughts per day, and 85% of the thoughts that we keep rethinking are the negative ones. Those are known as automatic negative thoughts. And it's been seen that these thoughts, which are negative, they are bringing about increasing our levels of anxiety, stress. Yoga helps you to realize that you are not your thoughts. These are separate from us. And it's been seen that because you become more and more mindfully aware of what is happening, you're able to cope with this better. It enhances our emotional resilience. And also because yoga is helping you to, because it enhances your mechanism, clears your mind, it helps you to think more clearly, your negative thoughts automatically reduce. And therefore, it's been seen whenever you have a high number of negative thought, it induces inflammation. It increases your stress levels, it increases your cortisol levels. And when you have higher cortisol levels, the factors which are cortisol has many bad effects. For one, it increases your visceral adiposity, insulin resistance increases. It decreases your expression of various factors which are promoting neuroplasticity. For example, people who have highly stressful lives, they are stressed for long periods, they have thinner gray matter, fewer neurons. So the yoga is helping to, this is cortisol is decreasing BDNF. Then it is also decreasing the levels of antioxidants. So you're again experiencing more oxidative stress. So this is how thoughts are able to affect your life and impact your health.
And I will catch up with a little thing before we move to anything else. You said that it is regarding that the emotions at the amygdala are reducing. Means these are the primitive this thing, emotions at this amygdala.
Yes.
How that is related and whether these emotions and this yoga practices are for the prefrontal cortex and the amygdala. So that just for my listeners, please.
Yeah, it's been seen that when you practice yoga, you actually decrease the amygdala is the center for fear, stress response. And people who are chronically stressed, they have larger size of amygdala, and large number of scans have shown that post practice of yoga on a regular basis, they have shorter, smaller volume of the amygdala. Whereas the volume of hippocampus, which is considered for memory, prefrontal cortex for cognition, for executive memory, there the gray matter increases. So that's how it is related.
Thank you very much. Thank you very much for a wonderful session. Now we are almost at the fag end of the session. So I would request Jaya Madam to give vote of thanks. So over to you, Jaya Madam. Please. Please unmute. Please.
Mute yourself.
Yeah.
Yes. Thank you so much, Doctor, for this very informative lecture.
Thank you.
Your lecture was an eye-opener as well as the reassuring one. See, you showed us the warning signals that the diseases which were entering in our life at a very late age have started now creeping in at a very young age, even in the school-going children, due to this high level of intake of junk food and lack of activities also. It was also alarming to know that our faulty lifestyle in current life impacts our next generation too. So we have to be we have to be more responsible for our incoming generation. Then hearing from the doctor who has done the doctorate in the genetics that yoga can improve even the DNA quality and the expression of genes is a very reassuring news for us. And you have covered almost all the diseases ranging from PCOD, infertility, arthritis, glaucoma, depression, even the aging process, and showed us with evidence of research papers how yoga helps us in literally each and every of these diseases. So this has reiterated our faith in you. So thank you, Doctor, once again for sparing your valuable time from your busy schedule and coming to this seminar. Thanks a lot.
Thank you so much, ma'am.
And Doctor, this is not our last interaction. We will be calling you, we'll be inviting you for our programs to give lectures. And on behalf of Yoga Vidya Niketan and all our management, I sincerely give you thanks for this wonderful section. And thank you very much. And with one Omkar, we'll end the session. So for Omkar, I will request Sonali Madam to take over and then formally we'll end the session. Over to Sonali.
Thank you, Nitin sir. As per the tradition of Yoga Vidya Niketan, we end today's wonderful Yoga Pushpanjali session with one Omkar. So sit straight, just close your eyes. Omkar, inhale fully and deeply. Om. Enjoy the positive vibration of Omkar on your body and mind. Now slowly and gently open your eyes. Thank you, Dr. Rima ma'am, and thank you everybody.
Thank you.
We will end the session.
Yeah, we'll end the session.